Hello, my name is Summer Smith, and this is my presentation about RTI. Okay, so RTI is a means of preventing learning and behavior difficulties. It's a method for screening and monitoring students and using their responses to specific interventions as a guide to identify those who really need special education services or just for additional scaffolding and support for them to be successful in learning. Depending on the school district or just the school, the RTI team consists of various professionals who work together in a partnership to provide effective interventions for students who are struggling. These individuals may include general education teachers, special education teachers, the school counselor, administrators, reading, math, or behavior specialists, school psychologists, and also parents. Decision-making teams should include members from various expertises, and a large component of RTI is to integrate the services that will really benefit the student to eliminate the situation in which the general education teacher is kind of doing their own thing and the special education teachers are doing their own thing and they're not really working together. So the more that they can work together, the best the students will be served. RTI consists of 3 and sometimes even 4 tiers to provide a problem-solving system for student underachievement. In Tier 1, the general education teacher is providing research-based classroom instruction, and this typically reaches about 80 to 85% of his or her classroom needs. Routine reteaching when appropriate and daily best practices provide the foundation of instruction that will benefit a large majority of the students. And then only students who are not meeting the standards will receive additional tiers of instruction. In Tier 1, universal screening in reading and math is an essential component. This kind of determines who will proceed in the additional tiers, and the process involves administering assessments to all students to determine who is likely to be at risk for academic difficulties, which happens typically 2 to 3 times a year. The second tier is usually about 10 to 15% of a class, and the teacher is either reducing the size of a small group and or increasing the time in targeted instruction based on the difficulties that they are seeing within the students. For example, a student may receive reading instruction on a specific area, such as phonological awareness, in a group size of 4 for 60 additional minutes per week. If this is not working for the student, they may move up to the third tier, which is even more intensive, usually reaches about 5% of the class. So a teacher may use a group size of 1 to 2 students and even more time, like 90 additional minutes per week. And sometimes even a trained professional, such as a special education teacher or a content-specific specialist, will also provide interventions. And this may or may not lead to a referral and evaluation of a learning disability and special education services. And also, depending on the school district and the specific school, sometimes it is the general education teacher who is providing Tier 2 and Tier 3 interventions, and sometimes it is a special education teacher. And as a student moves through the RTI tiers, another way to increase the intensity is to change the instructional practices or the materials that they are using so that they're more directly aligned with the students' learning needs. There are some critical elements that are part of RTI, which include some type of universal screener to identify which students who are at risk for learning differences. This also includes progress monitoring of students' learning, which is ongoing to assess their growth and whether their rate of performance is adequate. This data will be brought to the RTI team to determine the next steps, whether they are going to move to the next tier, if they're receiving a referral for evaluation, or to completely remove the student from RTI if they feel it is unnecessary. Also, another important element of RTI is the implementation of high-quality, research-based instruction that is matched to the specific needs of students through all of the tier levels. And the RTI team is required to make important educational decisions based on the data that is gathered. They're not just making decisions based on a whim or their feelings. They are specifically using the data to guide their decisions. The special education teacher plays several key roles in the multi-tiered RTI model, which includes collaborating with general education teachers, parents, and other specialists. The special education teacher also helps to identify children with disabilities. They are not diagnosing them specifically, but helping work with the teachers to identify which students are at risk for maybe a disability. And they are also offering intensive interventions within the tiers. And the special education teacher, as well as the general education teacher, should observe the child in different situations to really better understand the environment and how the interventions are working or not working, and what conditions the student seems to flourish or really struggle in. Observation should include a focus on how well the child is doing in comparison with similar peers, and it's really important to evaluate adequate progress, both in terms of how the student performs compared to grade level peers, and also their previous performance of their own growth. So seeing how far they've come as well as compared to their peers. Having parents or guardian input and support is also an essential part of RTI. A family should be notified early in the RTI process, typically by Tier 2 if their child is struggling, and the school should communicate their plans to try specific interventions and what the next steps will be. Parents should always understand what the interventions are for the tier they are currently on, the length of time, such as 4 to 6 weeks or whatever it is, that will be allowed for the intervention to see if it has a positive effect, and how often the student is being monitored. The parent should also understand how many minutes per day the intervention will be implemented, who is going to be providing the intervention, where the intervention is going to be given, what factors the teachers are going to be using to judge whether the student is successful or not, a description of the progress monitoring strategy that will be used. How are they going to see if the student is achieving their goals or not, and how frequently they will receive reports about their child's response to intervention. The more teachers can collaborate with parents, the better the outcome will be typically. And lastly, why is RTI effective for struggling students? It provides a structured framework for teachers to use evidence-based interventions with integrity. It uses frequent monitoring as a valuable database of information about the individual needs for each student that needs it. The textbook Strategies for Teaching Students with Learning and Behavior Problems specifically states this quote: "An RTI approach to determining educational need, as opposed to relying on categorical labels, keeps the focus of our professional resources where they need to be, on student outcomes." So RTI is a proactive method for parents and professionals to work together to ensure that the students with a learning or a behavior struggle get the appropriate support they need to be successful, whether it consists of a referral for special education or just using intentional instructional adjustments that they need to be successful. And my resource, the core of the information provided about RTI came from the textbook titled Strategies for Teaching Students with Learning and Behavior Problems. Thank you.